Hi everyone, I am Richard Vigorelli, your guide to everything Chinese medicine and Chinese astrology, all boiled down so us crazy Westerners can figure it out for ourselves. So today I'm going to talk to you a little thing that everybody knows about, pain. And specifically, pain involving acupuncture. Well, I had a patient a little while ago, and I was explaining to them what pain really means when I put a needle in you. And they asked me, well, doesn't acupuncture hurt? I mean, you are putting solid steel, pointy objects into the body, right? I said, yeah. And my answer to him was, well, acupuncture, yes, it can hurt, but not that much. Here's what I mean. There's lots of ways to be in pain. And in regards to acupuncture, yes, there is a piece of steel going into your flesh. And your flesh is alive, unless there's something you know that I don't. Well, it depends on the type of pain. So when a patient tells me, ow, that hurts, I ask them, how much? Scale of 1 to 10. Now, the pain scale of 1 to 10, or anyway, 1 means I can barely feel it all, there's just something there. 10 means I need morphine, you're a bastard, and please stop, I will tell you everything. That's what that means. Right here in the middle, 5, it's just annoying. So, when needle goes in, I am specifically putting that in a place to do a specific job. That job is to make you, the patient, better. I can't do that without putting the steel inside, especially if I'm working with an orthopedic problem. I can't just grab it and jostle it around a little bit, even though sometimes that's all you need, and hope it all comes out better. I also can't just put points in like this, willy-nilly. There is a logic to what I am doing. So when that needle goes in and you get the ow sensation, first ask, how bad does it feel? Scale of 1 to 10. You say 5. I'll say, okay, hold on to that a sec, okay? If it gets worse in the next minute, please let me know. If not, don't worry about it. If it gets worse, that means I accidentally nicked something. Hey, I'm human. I'm gonna make a mistake. If the needle goes in and you get that ouch sensation, and that ouch sensation decreases in about 30 seconds to a minute, that is actually a very, very good sign. What that means is that I hit that acupuncture point with my needle right on center. Perfect shot. Couldn't have done better if I had aimed. Well, I aimed. That ow sensation is just your body activating. And those functions in accordance with the point coming online. We're going to get the job done right now. That's what that means. It's really nothing to worry about. Now let's say I put the needle in and you get the sharp electrical pain that just runs up and down your leg or up and down your arm or up and down your body. Well, that means that I nicked a nerve. Sorry. It's an accident. Yes, I know where the nerves are in the human body. I did need to take a course in not only human anatomy, but human neurology as well. And yeah, I know where the major nerves are in the body. That doesn't mean I know exactly where they are or where all of their branches are. I can't see through solid matter, no matter how cool I think I am. So when that happens, that just means that I happen to have nicked the nerve. Don't worry, it'll heal. You're not going to get weird neuropathy, and your hand's not going to go like this, and you're not going to be walking around like this, and all of that from a little needle stick. That's probably not going to happen. Unless I keep jamming it in there and driving it in and flicking it and doing all of this funky stuff after you tell me, please stop it. Then, yeah, you could get some nerve damage. But if you say, ow, I'm getting an electrical pain shooting up and down my leg, I'll pull the needle out and say, there, is it gone? No, it's not. I will pull the needle out, toss the needle into the sharps container, and we're not going to use that point. Because of one of two, maybe three reasons. Well, I hit the nerve, which means the area is now inflamed. It believes it is under attack, so it's going to guard, which means any touching in it is going to be seen as an attack by the human body, and I'm not going to be able to help you that way. 2, the needle has now damaged the nerve. I need to leave the nerve alone so it can heal, and that's it. Possible 3, your mind is now trained on that area, and your subconscious, as awesome as it is going to believe that anything coming near it is an attack. And I'm still not going to help you anyway. So, best option when that happens is for me, the practitioner, to leave the area alone. Now let's say I put the needle in and you get a hot, burning sensation. Feels like a hot knife is driving into you. Well, that means usually one thing. You have what is called damp heat. If you don't want to know what damp heat is, well, damp heat is a combination of 2 separate pathogens in Chinese medicine. Heat and damp. They are not good together. Kind of like Bonnie and Clyde. So, the heat is the hot, and then there's that goopy, smoldering sensation that you get with it. That lingering sensation. That's the dampness. Now, why is it there? Well, if you look at my other video, damp heat can kind of go just about anywhere. It's almost like phlegm, but not quite. If I put needle in, we'll say, your calf muscle, and you get that burning sensation, well, that tells me that, 1, you have damp heat in your body, usually from bad diet, lack of exercise, a few other things, and it is migrated into the muscle layer. And chances are I am treating you for a damp heat condition. Like, goopy stool, horrendous breath, gas, ugly skin, things like that. That's what the damp heat is. But when it gets into the muscle layer and you put the needle in, it gets this weird burning sensation. It usually dissipates in about 30 seconds to a minute. Especially if I use what is called a sedating technique, which is, how can I do this? Like this. This is sedation when I manipulate the needle. Okay? This, by contrast, is tonification. I don't know if you can see that. Yeah. Okay? So, let's say that you get a slightly different kind of burning pain. And I happen to be right next to your Achilles tendon. That means I nick the Achilles tendon. And there are a few points where I kind of have to do that, and that's the point. Pardon the pun. So, when that happens, what I will do is I'll put my hand probably on your shoulder, and I will say, it's okay. Breathe through it. You're okay. You're okay. Nice deep breath. It's okay. And the problem usually goes away. If it gets worse, however, well, I just pull the needle out, massage the area nice and gentle, everything's fine. But what about those points on the body that always hurt no matter what? Well, there's a few. One of them is right here. It's called stomach 3. Excuse me, small intestine 3. This point always hurts, but it's an extremely useful point. We use it for back problems. We use it for a few digestive problems. We also use it for hand problems. It's a fantastic point. I hate having it needled on myself whenever I go to get treated, because, I may have worked out a little bit too hard in the yard or lifted something not quite right. Now I got a little bit of a twinge, or my neck is, ow, tight. We're going to need this point. Well, when that gets needled, I'm going, oh, come on, dude. Why? Why do we have to do that? You know why, doctor. Fine. So it goes in. I'm like, ow. And I'm fine. Okay? There's another point like that. Now imagine my hand is my foot. This thumb is my big toe. So just kind of bear with me. We'll pretend it's a little bit longer than it is. Right about here on the foot is a point called spleen 4. It always hurts. It's a lot like small intestine 3. We use it for bleeding problems. We use it for gynecological problems. We use it for profuse vomiting, from indigestion, from food poisoning, and, well, we don't want you to dehydrate and puke up the herbal formula that we're going to be giving you in about 10 minutes. So we'll put a needle in there. It always hurts, but the pain goes away in about 30 seconds to a minute, just like small intestine 3. I just tell you, grit and bear it. There's another point just down from spleen 4 called spleen 3. It's right on where the knuckle is, where it connects into the foot, on the big toe. It's just behind that. It hurts, but it's extremely useful for weight loss. It's extremely useful for indigestion. It's extremely useful for someone that can't think straight. And there's a few others. There's 1, 2 on the palm of the hand. Great for insomnia. They hurt. Great for someone that's got a bit of a temper right now, but they hurt. Great for someone that's kind of flying around, laughing around all day, being kind of a general obnoxious twit, but they hurt. But the pain goes away in about a minute. You won't even notice it afterwards. You'll go right to sleep. Other points that hurt, well, one on the tip of the ear. Right here. Fantastic for high blood pressure. Fantastic for a fever. I know a lot of people are probably going to get really upset about this, but one of the traditional cures for fever in a child is to prick this little area right here. It's called apex of ear. Just 2, maybe 3 drops of blood on somebody that's got 105 degree temperature and the antibiotics aren't working. The temperature will plummet down somewhere around 199. Somewhere between 99 to 100 degrees. So it goes from a burning, I'm going to die fever, down to basically nothing. And it hurts when they do it. But hey, it's up to you. Fever, momentary discomfort. Up to you. There are a couple of other points that hurt. A lot of them are called Osher points, which is Chinese for, oh, damn! Ah, sure, there's the point right there. Yeah, it's kind of what it means. We use those for tight muscles. We use Osher points for someone's been working out a lot, somebody that got dinged up. Maybe they were in a fight, maybe they took a spill, maybe they just slept wrong, or they've been cooped up in a position in the back of a truck for 6 hours, and well, their body's now used to looking like this. I put a few needles in, and yeah, it's going to hurt. But that discomfort is nothing compared to the muscles in skin themselves being damaged, being in pain. Can you imagine having a neck ache for not just a couple of days, maybe a month? Yeah, I had a guy do that. Now, my very first acupuncture treatment was for my bum knee that went through a windshield. I'd been living with constant pain for half of my life. And yeah, when those needles went in, they were big, they were long, and they hurt. But you know what? When I got off that table 30 minutes later, and for the first time since I was a teenager, I could walk without wincing. I was so happy that I hugged the guy that put the needles in me. So, does acupuncture hurt? It can. It is not my goal for it to hurt. My goal is to make you better. Sometimes I gotta take you through a rough patch to get to the good stuff on the other side. So, when an acupuncturist like myself puts a needle into your body, please have the faith that they know what they're doing, and please have the confidence to know that it is their job to make you, the patient, better. Okay? If you have any further questions, please feel free to contact me down below in the comments. And while you're there, why don't you hit that big red button that says subscribe, especially if you're new to my channel. And if you want to talk to me directly with anybody knowing anything about it, please visit my website at vigintmed.com. That stands for Vigorelli Integrated Medicine.com. Link is in the description as always. You can go ahead and send me a message through there, and I'll be happy to answer any question you have. I will do my best to make sure that you can understand what I'm saying. Sometimes, we talk above head. Anyway, it's my goal as a physician to give you knowledge and to empower my patients and to empower the people around me. But I can't do that if you don't ask me questions. So, again, my name is Richard Vigorelli, your guide for everything Chinese medicine. I'll be back next time with something else, but until then, take care, stay healthy, and I'll see you later.